Hi, my name is April Perry. I will be discussing inspection of the abdomen. The objectives are discussing the appearance of the abdomen, what's normal and what's abnormal, the quadrants of the abdomen and what body cavity each organ lies in, how to properly examine the abdomen, define and discuss the symmetry of the abdomen, define ascites and important manifestations, obtaining health history, important client teaching and health promotion. My client is my spouse, Dietrich Perry, and a written consent has been obtained. At this time, we will introduce Dietrich. You can go ahead and take your shirt off. You will ask the patient to remove their top clothes. Inspection of the abdomen. The abdomen is a large oval cavity extending from the diaphragm down to the pelvis of the brim. The abdomen is divided into 4 quadrants. The right upper quadrant is the liver, the gallbladder, the colon, the pancreas, the right kidney, and the adrenal gland. In the left upper quadrant, we have the stomach, the spleen, the left kidney, the colon, and the pancreas. In the right lower quadrant, we have the appendix, the colon, the small intestines. And in the left lower quadrant, we have the colon, small intestines, and the ureter. When you're inspecting the abdomen, you should note that it's smooth and even. Some common changes with the abdomen is striating, commonly called stretch marks. It's usually silvery white, linear marks that occurs with excessive weight gain or during pregnancy. Pigmented nevi or moles can also occur, and you will be expecting that on the abdomen. Note if there's any lesions other than surgical scars or heel scars. You want to ask the patient about those due to underlying adhesions and excess fibrous tissue. You also want to note the appearance of the abdomen. Is it flat? Is it distended? Is it round? Or is it enlarged? Before you examine the abdomen, you want to ask your client to empty their bladder. And you also want to have adequate lighting, and you want to also have the room warm. You also want to wash your hands or use hand sanitizers and put on gloves. Once your patient has emptied their bladder, you can have them to lie down in a supine position with the examiner on the right side. If the patient is completely undressed, you want to make sure you provide as much privacy as you can with the patient. You can use a sheet to drape the lower half of the patient so you can just expose only the abdomen. The patient is lying supine position on their back. The examiner's on the right side. You want to stoop and gaze at the abdomen with the examiner head slightly above the abdomen. You want to determine the profile of the rib margin to the pubic bone. The contour describes the nutritional state of the patient. You can tell whether a patient is obese, if they're healthy, or if they're malnutrition. While the patient is lying flat, the examiner can shine a light across the patient lengthwise or toward the person. The abdomen should be symmetrically bilateral, no bulging or no visible mass. If the patient has any hernias, you want to ask about that. And you want to also assess for the lesions. You want to ask them if they're healed or if they're unhealed. The umbilicus. The umbilicus should be centered. It should be midline and inverted. No signs of discoloration, inflammation, or no redness or crusted. Okay, you can sit up. As nurses, it is very important for us to obtain a thorough history of our patient. You want to ask the patient about their normal bowel patterns, their appetite, any nausea or vomiting, any diarrhea, any past surgical histories, and their nutritional state. At this time, we will assess our patient. Are you having any change of appetite?
No, not at all.
Any weight gain?
No.
What about weight loss?
No.
How often do you weigh?
Once a month.
Do you have any difficulty swallowing?
No.
What about food? Are you tolerating all your food okay?
Yes.
Do you eat 3 meals a day?
Yes.
Would you say you eat healthy?
Yes.
Choose healthy choices?
Very healthy.
Are you having any abdominal pain?
Not at all.
What about any nausea, vomiting?
No.
Okay. What about your bowel habits?
Baby.
Any constipation or diarrhea?
No.
Have you had any past abdominal history such as any ulcers, hernias, appendicitis?
No.
Have you had any x-rays?
No.
Colonoscopies?
No.
Okay. You take any medications on a regular basis?
No.
Okay. If a patient is having any food intolerance, you want to ask them when. What type of foods? When do you notice it? They're having difficulty swallowing. You also want to assess when do they notice it? What type of foods? Is it morning or is it night when you notice that? Abdominal pain. You want to ask them where is it hurting? How often does it hurt? Does it move around or is it constant? You want to ask your patient to describe. Nausea, vomiting. Ask your patient how much, when, what color. Does it smell? Is it bloody? Are you tolerating any foods when you're nauseated? Are you taking any medications? What relieves your pain? Bowel habits. You also want to note constipation and diarrhea. What medications are you taking for constipation? What medications are you taking for diarrhea? And is it helping? Medications. Some herbal remedies cause hepatitis. So when the patient presents to the doctor, make sure they bring all their medications and over-the-counter medications. Nutritional assessment. You can gather much information by looking at your patient and by just looking at their abdomen. At this time, I want to talk about health promotion. Obesity is one of the biggest concerns with our society today. We want to encourage our patients to make healthy food choices, to drink plenty of water, avoid alcohol, and always discuss your medications with your doctor, even though it is over-the-counter medications. Notify your doctor of any change of bowel habits, nausea or vomiting, difficulty swallowing, and always inform your doctor of past medical history, any surgeries. One common condition that I would like to discuss containing to the abdomen is ascites. Ascites is a fluid collection in the abdomen. It is caused by increase in portal blood pressure and decrease in albumin. The most common cause of ascites is cirrhosis of the liver. Diseases associated with ascites is severe liver damage, hepatitis B virus, hepatitis C virus, and associated cancers. Symptoms for ascites. If a patient has a small collection of fluid in their abdomen, usually they will not have any symptoms. If they have an increased fluid in their abdomen, they will have increased shortness of breath, chest pain, abdominal pain, bloating. Treatment for cirrhosis. You want to have your patient to avoid alcohol, decrease in salt intake, fluid restriction, diuretics such as Lasix. and they also could be treated for possible antibiotic infection. Procedure for ascites is paracentesis, that is inserting a needle in the abdomen and withdrawing fluid from the abdomen. So to recap an inspection of the abdomen is divided into 4 quadrants, and there are some common changes associated with the abdomen, such as pigmented nevi or moles. You can also have silvery white linear or jagged marks called striate or stretch marks. You also want to ask your patient to make sure they notify the doctor of healed or unhealed surgical incisions, and it is cause of excess fibrous tissue and underlying adhesions. Always assess your patient for any changes such as bowel habits, nausea or vomiting, any changes in their weight. So the most important thing we want to remember is health promotion. We want to tell our patients to make healthy food choices and also drink plenty of fluids. This concludes my inspection of the abdomen. Thank you.